Okay, so you had these four. What does your follow-up look like today?
So I haven't had, it's been years since my Mohs surgeries, but since my Mohs surgeries, I go to the dermatologist every 3 months and he looks me over. I also look myself over. And you know, I actually rely a lot on the doctor though to find something, but I'm usually the one that comes in with like, oh, there's this and there's that, you know, we should check that. But he really, you know, he really looks me over, you know, and you know, clothes off and everything with, you know, just the gown, and he really examines me closely. And I feel very confident about that he's very thorough. So so I rely on him for that, for as far as the follow-up goes. But as far as the Mohs surgeries I had, the follow-up on the squamous is, for a while they were doing axillary palpation, you know, because it was the incision was on my upper arm, because I guess they have to worry about there could be a metastasis of some kind at a later time. And it's been such a long time now that they don't need to do that anymore. But so it's just a, you know, friendly visit every 3 months to the dermatologist now.
Now, you had an interesting way of identifying spots of concern. Can you I thought that was brilliant.
Well, my problem is that sometimes, and I'm sure other people have this problem, you go to the doctor and it's deer in the headlights, you know, and you're like stage fright. And it's like, gee, there was something I was going to tell them. And I do a couple of things. I have a 3x5 card, and sometimes I find a little rough spot or a little raised spot, and I write it on the card, left cheek, you know, back of my neck, whatever. And it's usually not something that's terrible. It's just I want them to take a look. And then sometimes when I go in, I'll actually find them again, because just because it's the left cheek, it's like, where is it? I go in the morning. Sometimes I'll put a little Band-Aid over a couple areas that I really want them to check. And it's like, oh, please, it's under this one, that one. He laughs, but it's like I get it looked at, and then I have the confidence of, you know, him, you know, taking a good, serious look at things. So
yeah, no, I think those Band-Aids are a brilliant solution.
It's silly, but
looking at what was going on with COVID, where patients were, you know, referred back and had to wait a long time. Sometimes they were literally circling lesions on patients and telling them, don't wash that off with, you know, it was like almost like a Sharpie. So I think that's great that you had an easy way up for self-identification of these lesions that you're concerned about.
Yeah.
So that's great.
Yeah.